Theo. Today we're going to talk a little bit about asthma. So, the first question is, what exactly is asthma? Well, we have enough lungs for running. When we sit still, we do what's called zone breathing. That means you breathe the top third of your lungs for a little bit, then the middle third and the bottom third, and you rotate. The air is directed by little airways called bronchioles. Each of these has a muscle that opens and closes to direct the airflow. And what you want to do is have a maintenance cycle where things shut out in regular intervals in order to do repair. If a part of your lungs becomes injured or sick, then that area also will shut down for further repair. Sometimes, genetically, people have overreactive bronchioles, and so they all decide to shut down at the same time. And this causes you to move air through a small hole. Air that goes through a small hole makes a whistle, also what we call a wheeze when it's breathing, and so people who have asthma will often make sounds like as they're trying to force air through small airways. People can develop asthma also as a result of infections. Certain infections, particularly Klebsiella and Moraxella, can produce a toxin which can permanently damage the system that is used for regulation of the bronchioles. Toxin exposures, so smoking is certainly one. Glycerin exposure, there are other toxins which can cause damage to the lungs as well. And pretty much everybody has a certain amount of an asthmatic reaction as temperatures get below. By the time you get to -40, pretty much everybody's acting like an asthmatic, but I would recommend if it's -40, you just stay inside. So that's basically what drives asthma. So the second thing that occurs, though, is very often when people are having a worse problem with asthma is because these airways are smaller, you try to force air through these airways, and you do that by coughing. Well, when you cough, it's like hitting these airways. If you hit your thumb with a hammer, it swells up. You hit the airways, they swell up too. So we started out with here, the muscle went down to here, now you're swollen down to here. So now we have two problems that we have to deal with. So when someone has a significant exacerbation of asthma, often we're going to give them a medication called prednisone. Prednisone is a strong anti-inflammatory medication. It helps reduce the swelling in the sides of the airways in order to open them up and allow people to start breathing. It also breaks that cycle of coughing causing swelling and swelling causing coughing. In addition to that, we'll often use a long-acting bronchodilator. So your normal albuterol inhaler, the little L-shaped inhaler that you've probably seen people use, lasts for about 4 hours, which is great if you want to sleep from 10 to 2, but I find many of my patients would like to sleep longer than that. So having a 12-hour inhaler, something like Advair or something along those lines, is nice because then you don't wake up in the middle of the night coughing and then you think about using your inhaler and you wait an hour or so coughing and coughing, so you're turning before you finally break down and use it. And that helps to avoid this cycle of inflammation causing coughing and coughing causing inflammation as well. In addition to that, these combination medications do have inhaled steroids. The nice thing about an inhaled steroid is that I can give you the same effect on your lungs as a higher dose of oral steroids without the risk of weight gain and those sorts of things, thin bones, thin skin, which are risks from long-term steroid use. And so in addition to that, treatment with combination products with a long-acting beta agonist, a long-acting kind of version of albuterol, that is, along with a corticosteroid, reduce your risk of death, hospitalization, emergency visits, and having to see me, all of which are good things to reduce. Generally, when we talk about asthma, our goal is to try to be more aggressive at first and then slow down. If you take more medication or higher doses early on and we get things under control, your overall exposure to medication will be lower over a course of weeks, months, or years. And so that's why we like to be a little bit more aggressive when things start out. If you're the sort of person who struggles with asthma, and sometimes people aren't sure how well their asthma is controlled, there is a device called a peak flow meter, which measures how well your asthma is doing, and that's something that you can get. They're about $15 on Amazon, and be happy to help you figure out what your normals are. That is also another thing that we can do to try and help people to assess where they are in the process of asthma. So there's a lot of things that we can do for asthma. We can make people have a lot less symptoms. We can make them live longer. We can help them breathe. If you have questions about these things, you think you're struggling with asthma, we're always happy to see you. Feel free to see us in the office. I hope you have a good